So the idea is just to talk about understanding behavior and from these psychological views, and to start and to understand these things which are so where we focused on and which are so special in Prader-Willi. And yes, go to the next. And I will start with some news, which are not really news, and you can go on with the next things. Yes, good news and bad news. And the first good news is, yes, people with PWS are humans like we are. And the second thing is, it's not really news, but humans' behavior are very complex to understand. So, and go on. Next slide or next thing. And so the consequence of this is it is a big and very complex task for parents and for professional caregivers to understand and handle the behavior of people with Prader-Willi. What I try to explain in these some minutes which I have today is to give a very short overview of which approach or psychological approaches and views we should use, because behavior is in humans and in people with Prader-Willi a very, very special thing, and it is not easy. And if someone is coming and explain you behavior of people with Prader-Willi with very simple things, then you can be sure, and this is what I saw over the last 30 years, that's not helpful. So it is complex, and these psychological approaches can help to understand. The first thing is a system theory perspective. The other thing is the cognitive development, social development, and the behavior analysis, and the things of Martin Seligman, the positive psychology things. So now we'll go through all these things very fast, but I think at the end, I hope you understand that these complex things could be better understood by using these psychological approaches. So go on. The system, next. The system theory helps us to change a view of people with Prader-Willi, or of people. In years ago, it was a situation that we see the person with Prader-Willi, and we see them, and we see that experts are looking on this person, and they have ideas for this. And the system theory or the perspective changed things and go on. What we do more and more is that we also look at parents, siblings, teachers, and all the others, and we put the person with PWS out of the middle. We put them in the field, and what the new situation, or what the thing of the system theory is, they put the person with PWS out of the middle, look at all the other players in the field, look at the subsystems like family, like subsystem of professionals, and see the interaction between all of them, and what the influence of the others in the field are on the one with Prader-Willi. And since we do it in this way, we have the chance to change things, sometimes without doing anything with a person with Prader-Willi. And so I think this system theory, or this systematic, or no, this system theory view on people, especially on people with Prader-Willi, are very helpful to use the chances and to use the resources in the environment of them. The next one. The next slide. Yeah, it is the second thing which is very helpful from a psychological view is the cognitive development stages of Jean Piaget. And many of you know this theory, and it is, in simple words, it describes different stages at different ages. And when we know about the things which happens in these stages, then it makes it for us easier to understand where people with Prader-Willi stands in their development. And if we have a look at the, for example, the second step, these age from 2 to 7, and go on to the next slide, then we see that in this age, very typical things happens or develops, or people have to overcome these things, these inappropriate generalizations, egocentrism, decentering, or missing transformations. This is what we often see by youth or adult people with Prader-Willi. And if we make a diagnostic and we see that they are in a developmental or cognitive developmental stage, we have an idea and we can use the knowledge how we can support them to come and to go in the next stage. So next. The next thing is the social emotional developmental age, and this is something what Anton Dogen described years ago. And it is also, it describes different stages, and in different months or in the development of children or youth, normally you find these steps, and in each step, go on to the next slide. In each step, you have to describe which step you find in these different fields. And you see it is, these are 8 fields dealing with your own body, emotional differentiation, communication, affect, regulation, and so on. And if you go on to the next slide, and if you make a diagnostic and you find out which level the one have in this moment, and it can be 15 or 25 or 5, you can see what the average is and in which social emotional developmental age the one is. And it is very helpful to use this method when you are working together with people with Prader-Willi. Go on. The next thing, it is, I think this is also what many of you know, it is this method of behavior analysis. And what we do when we see a problematic behavior is we look at the behavior in the situation. Is there an eye contact? What is the facial expression? What are the movements? And go on. And we next, and we see what is around the situation. It's not only the behavior of the one with Prader-Willi, it's what who is in this moment, who is there, who is not there. And the other things are the preceding conditions. What happens 5 minutes, 10 minutes, a week, or a month ago, which influence the actual behavior. And also on the other side, the consequence. How do we react in the past? Was it helpful to reduce the problematic behavior or not? And next thing, and a very important thing is to know about the biography, about the life story of the one. Are there traumatic things? What happens in school, in kindergarten, in the family? And all these knowledge is necessary to understand what the behavior or what the one shows us or will say us with his behavior, with his challenging behavior. And the last, go on, is the question, when does this problematic behavior start? Normally, these challenging behaviors do not start at birth. And it is very interesting when it was the first time. And what way of development it shows over the time. Sometimes we feel we find very special situations, sometimes changing school or sometimes changing the group homes or something like that, or the death of someone in the family. Go on. And the last thing from a psychological view, which is, I think, very interesting to understand behavior or challenging behavior, is this theory of Seligman, where he describes 5 elements: positive emotion, engagement, like doing things, like reading a book or walking or watching TV, things you do by yourself. social relationships, how much we have or someone have, how much in the group home or in the family and how much out of the family. And the experiencing of meaningfulness, for example, your work in a sheltered workshop, or the structure in the family or at school. And the last thing is the self-efficacy experience. To know and to know that you do things by yourself and that you are successful with the things you do. And go on to the next slide. Next. Yes, these. And also, if you can find out how high the level is in each of these elements, it explains you often why we see so much challenging behavior in this time. So, for example, if there are less social relationships or less positive feelings during the day, then people often feel unhappy, and this could be a reason for having challenging behavior. And go on. To develop these things could be very helpful, or could be preventative, and go on. And all of these psychological views should describe that we have to use, and we have the chance to use these theories to have to understand what is behind the behavior. And it is like the behavior of humans are very complex, and to use these methods is a chance to do it not in a simple way. What I say at the beginning, this is what I saw over the years. When we try to explain it very simple, then we fail, and then we find not good solutions, and not good ways to support people with Prader-Willi. So what I will say at the end is, it is complex, but let us use the different psychological views and approaches to understand and to support people with Prader-Willi. So thank you very much. I hope it was not too much in such a short time.